Hi, I'm Dr. Magana, plastic surgeon here on the Upper East Side, Park Avenue. This is my second blog with Mark. It's a pleasure to be here, and I hope it's useful for you. And I'm going to talk a little bit about just general care of the skin and how to look a little bit better in these, especially in this summer heat and sun. It's very important to protect yourself from sun rays, UVB specifically, and UVA, because UVB can be bad, as in big B, and also A as an aging. UVA can certainly affect the quality of your skin over time. So it's very important to protect yourself from these agents and to use a good SPF cream. Anything above 35 I'm happy with, but there are some baby creams out there that are 50 and even 100, and I recommend to really protect yourself against the sun, because it does make a difference over time with the skin. Also, good moisturization on a daily basis, a regimen that you should follow possibly every night or every morning after you wash your face to make sure that your skin is well taken care of. And these things help to maintain a young looking skin. We don't necessarily want hyperpigmentation, which means just sunspots or dark areas or red areas on the skin, which when they do appear, there are treatments for them. But we try to avoid them. Now, in the kind of spectrum that we have for treatment of skin, we have things like very mild retinol type peeling agents that are very, very mild and can be used a couple of times a week. And they are prescription. 4% retinol can be obtained at your doctor's office with a prescription. Then from there we take it on to a variety of other treatments for rejuvenation and skin treatment, including IPL, which is intense pulse light, and that helps also to make the face and skin of a uniform color, which is a rejuvenating kind of a treatment in terms of appearance. And then from there, skin tightening, and there's a variety of treatments for that, including ablative laser, Fraxel laser, which tightens up the skin. And then there are deeper treatments such as the Ulthera, which is an ultrasound-based therapy, which tightens up the skin, but not just the skin, also tightens up the muscle, the subcutaneous tissue, which is just under the skin, and the actual skin, which is actually a fabulous new technology that's been around for a few years, and it's something that's available to the general public through your dermatologist or your plastic surgeon. And aside from that, the next step forward from that would be surgery, skin tightening, muscle tightening, facelifts. Those are alternatives that are a little bit more invasive and do require a little bit more planning, but certainly in the right candidate can give you a very, very good result. There is a middle ground before surgery, which is enhancement or mild enhancement with fillers. Fillers such as Radiesse and Juvederm that, if used correctly in the right places, give a natural look at the areas of our face that start to kind of deflate. They start to kind of sag a little bit. So it helps us to be able to kind of fill that up where fat is lacking, as opposed to our younger years where we have a plumper, fuller face, more juvenile, more pleasant appearance. So fillers help to do this. When we have very pronounced wrinkles around the eyes or the forehead, or in the mid portion of the forehead, the corrugator area, Botox helps quite well when it's given just the right dose. So it's a balance to give just the right dose, so you have some motion left, but not enough that you have those pronounced wrinkles. And that treatment will repeat every 4 months or so. And those are the general recommendations I give in that order, from just general skincare to all the way up to actual skin tightening surgically done. And those are the weapons we have in our armamentarium of youth. If you have any questions, please don't hesitate to contact me through Mark Leland, and I'll be happy to answer any questions on this blog that you may have.